What are some of the most common consultations we get on general surgery or acute care surgery call? And I have Lennox with me today. So I think maybe in no particular order, these are probably the top two though. These are a little lower down. Acute appendicitis and acute cholecystitis, definitely probably number one, number two, interchangeably. And then diverticulitis and a small bowel obstruction. I would say these are probably our top four most common consultations while on acute care surgery or general surgery call. So you guys tell me, how does acute appendicitis present? All right, good. So we're talking right lower quadrant abdominal pain. So pain that maybe starts periumbilical and it migrates to the right lower quadrant. The patient's gonna have maybe some associated nausea, vomiting, fevers, increased white count, maybe a temperature, all those good things. And we're gonna get a CT scan in 99% of these cases, and it's gonna rule in acute appendicitis. All right, how about acute cholecystitis? Where's the pain there? Well, you guessed it, the right upper quadrant. What is our imaging study of choice in acute cholecystitis, or when we suspect right upper quadrant abdominal pain? A little different there, good. You start with a right upper quadrant abdominal ultrasound because we're trying to identify whether the patient has gallstones. Then typically we end up with a CT scan. And then what are some other imaging studies if, say, patient has elevated bilirubin? MRCP, good. And then a HIDA scan is another imaging study. I have plenty of videos on all these things. Now, how does acute diverticulitis present? Good. So now we're talking the left lower quadrant, okay? So they have diverticulosis. One of those outpouches of the sigmoid colon becomes inflamed, and that's how you get diverticulitis. Same thing, white count, fever, nausea, vomiting. And then our bowel obstruction, more diffuse abdominal pain, distension, nausea, vomiting, inability to pass gas. Maybe they haven't had a bowel movement in a little while. And again, here, definitely want that CT scan. And we're gonna break down each one of these a little bit further in some other videos.